Hi, everybody. Welcome to pharmacology class. So it's PNS 206, Pharmacological Caring and Nursing. My name's Miss Yeager. I'm going to be your instructor. Hopefully we'll get to see each other soon. They tell me 4 weeks, but we'll see for sure. Things change. But anyway, I just want to go over what is expected of the class, what I expect you to do, things that need to be done. If you have any questions at all, please don't hesitate. Message me on my cell phone, and I'll go over that in the syllabus. Okay. Syllabus should be on course sites. So if you have any issues with that, I know Mrs. Jones was downloading it, so hopefully it is on there. If you have any issues with that, please message her so she can put that on there. But as our textbook is the understanding of pharmacology, the essentials for medication safety. That is the book that we're going to be using. And like I said, it's a very nice book. It does help a little bit. So hopefully you do like it. All right, so let's talk about the syllabus. Okay, now the syllabus, like I said, on page 2 of the syllabus actually has my phone number as well as my email. Now the phone number, that is my cell phone. You can message me at any time, but if you do message me, please tell me who you are so I can have that and I can message you back. But that is probably the best way to get a hold of me. I work midnight, so sometimes my messages don't come to me for like a day or so, but I will message you back, and if you have any issues, not a problem. Now, email, if you email me, that takes longer because I'm not on my email 24/7. I usually check that maybe once, twice a week, just depending on what I have to do. So that will, the easiest way to get me is by messaging me on my phone number, and that is on the second page of the syllabus. If you have any questions, you need to visit me one-on-one. You can always message me and we can discuss that. Hopefully in this COVID thing, we'll be heading out soon so we don't have to stress anymore over this. But otherwise, read through the syllabus. On page 3 is just telling us what is expected on this course. You will be having 10 examinations. 1 through 9 there are 25 points. They are questions that come from the book. Questions that come from the bank and all that are going to be critical thinking tests. It's not going to be something like what color are the doll's eyes, something like that. It's going to be critical thinking. This is to pull you out and make you start thinking of what you have to do. The questions are very technical. You have to read those questions and you have to really concentrate because clue words are in there. But this is preparing you for boards, and it's also preparing you when you give a patient medications. It's like trying to get you to think first before you do actions, trying to see things before other things can occur. So that's why we do these type of questions. They're not going to be basic yes, no, 50-50. It's going to be critical thinking questions. So like I said, exams 1 through 9, there's a total of 10 exams. 1 through 9 are going to be on the chapters that we go through. And the 10th examination, that's usually the last week before finals, that's going to be the HESI specialty pharmacology exam. And that is something that's going to be done on the computer. I cannot tell you what's on it. I do not know. It's to help prepare you for boards, to see where you're at and where you need to educate yourself a little more. So I do not know the questions. I can't tell you. But the nice part is everybody passes. Okay, it just goes by what score you get. So everyone will pass that examination. Don't stress over it. But do prep for it by going through your chapters, getting into your account on the book, and start looking up questions and answering questions and going through the different chapters and what is expected and answering those things. That's going to help you big time. So those are the first things. So that's 250 points just from the examinations. Midterm will be 200 points. So that's a 100-point test. And there, so that's times 2, so that's where you get your 200. So it's a 100-point midterm, and then your final examination is 150 points. All the tests are cumulative, so it's whatever we've learned through that. Midterm will be up to whatever we stop lecturing at, and you will be responsible for all that. And the final examination will be over chapters 1 all the way to 32. So that's going to be the entire book. So those where we get our examination points. Now homework points, there are different things we're going to be doing. Homework, we do have the workbook or the study guide. You are responsible for the study guide pages, and that's going to be there's 32, but you're not responsible for chapters 4, 5, no. Yeah, 3, 4, 5. You're not responsible 3, 4, 5, the math chapters. That you're going to be doing in lab, as well as you do have a math that you've had examinations and you will have tests. So that's going to be responsible for lab. You'll be doing some math with your medications. So that is something we will not be going over in class. But if you do, not an issue to prep yourself and look at that too. So that is what we're going to do. So those workbook pages, they do need to be turned in whenever they're due. The workbook pages are worth 4 points each. And with the workbook pages, I don't care how you turn it in. If you want to give me a piece of notebook paper with the answers on it, just make sure you tell me what chapter it is. If you just want to hand me your book, and I can correct your book. If you just want to, tear out the sheets, I'm okay with that. Photocopy it. I don't care. As long as I get those, answers, that's fine with me. And like I said, when we look at the syllabus, it will tell you when those chapters are due in the workbook. So homework, so far we got is our workbook. The second thing is you will automatically get 30 points for class participation. And that's, given through, talking in class, anything we do, if we do any projects or anything like that, that will be part of class participation, and that will be 30 points. And then the last thing we're going to be doing is you have 104 drug cards that need to be turned in. And we'll talk more specifically about the drug cards in a little bit, but they have to be turned in, 104. These drug cards are going to be very helpful for you to help memorize things, because these are the medications that you're going to see more frequently used. And you're going to see them in clinicals. And the nice part about it is when you're in clinical setting, these are the drug cards that you can bring in, and you don't have to write them out on your care plan. You just bring the drug card in. It's also going to help you when the instructor's, quizzing you on a certain medication, and you've looked up a patient, you can pull out those drug cards, read up on it, and you'll be able to tell the instructor, oh, it peaks at an hour, oh, I'm supposed to not give it with grapefruit juice, so there's going to be little helpful clues to help you with that. So that is another part of the homework. As we go through there, read other parts of course, plagiarism. You can read about the different chapters, what's expected, what you're going to be learning from it. That's going to be very helpful. I'm just looking through these things. Of course, any questions, do not hesitate, message me. Now on page 18, okay, 18 is telling you exactly what we're going to be doing each week and what is due for the following week. Now I will tell you, I'm not always up on the chapters. I try my best, but sometimes we get into a lot of discussions. People have a lot of, things they want to share, and that's what I want. I want us to share things. I want us to learn, and, experience is the best thing ever. If you can get people's real life experiences, that's a lot of times how you learn. And working in the emergency room, I have a lot of good stories to tell, a lot of things I've done in my nursing career that I will share with you. And if anything that you guys seen in your careers or your life, I expect, share them, because that's how we're going to learn. So on page 18, of course, we're going to have Thursday class. It's supposed to be from 8 to 11. Like I said, I can't do the Zoom meetings because of my internet thing. That's why I'm taping things and letting you guys look over them. Best thing I can do because my internet's in and out. So on this, you'll see week 1, which is Thursday, which is 5/28. We will be going over chapters 1 and 2. Okay, 1 and 2. This is going to be the meats and potatoes, I call it. Meats and potatoes. It is what you need to know about medication. It's everything about meds, how to give meds, what you're expected to do, how to give drops, what to do about patches. It is everything you need to know, and you have to learn that stuff. Why do we do this? What is, you know, peaks and troughs, so we're going to be going over that when we discuss that. So you can see that it's what we're going to be doing on the first week. So what is expected you to do is to read chapters 1 and 2. Now, you can see on the last column, it says SG. That is your study guide or your workbook. Now, chapters 1 and 2 you need to do, but they're not due until 6/4. So the following week they will be due. Okay, so the second week, which was 6/4, we will be discussing chapters 6 and 7. And what is due for you to hand in at the beginning of class is chapters 1 and 2 of the workbook. And then you can see at the last column, following week, chapters 6 and 7 are going to be due, and then there's drug cards that need to be turned in. Okay, so that is what we're going to be looking at, and I'll be talking about drug cards soon. Now, you can see on the second week, it says we're going to review chapters 3 through 5 in the lab in PNS 205. Okay, we will not be going over chapters 3 through 5, so I don't expect you do not have to hand in the workbook pages, but if you want to, you're welcome to do them. I will grade them. I will grade them for you just for practice-wise. If you want practice, that's not an issue, but it is not a part of, part of the grading process. It's just if you feel like you need to boost up on your math, but we'll be doing that in the lab. And then you can see on the third week, we're going to have our first examination, and usually it will be over chapters 1 and 2, but that will be our first exam, and then we are going to lecture on chapters 8 and 9, and then it's going to tell you that next week what drug cards are due and what workbook pages and that are going to be due. And you can see so on and so on as we go down. The 8th week will be our midterm examination. And then we have to do the 15th week. That is our HESI exam. That is the one I told you about. Don't stress over it, but do start preparing yourself by going through the book and answering questions and all. And that will be the last week. And then, of course, the 16th week, that is our comprehensive final examination, which will be at 9 o'clock. It's 9 to 11. Now at the bottom of 21, you can see, page 21, you can see drug cards, like I said, 104. They're both all worth 1 point each. And then, of course, our workbook pages, that's the SG, the study guide. There's 29 assigned chapters that you have to turn in, and those are at 4 points each. Now, the only thing I expect you to do with the study guide is the practice test in the back. You do not have to do the beginning, just the practice test. So you don't have to fill out the entire chapter of the study guide. All I need is the practice test. If you want to do more, that's fine, but you're not responsible. I only want that back portion, that practice test filled out. And that is what you're going to be graded on. But if you want to fill out the rest of it, I have no issue. I will grade it for you. That's not a problem. So that's the only thing you're responsible. Those are worth 4 points each. And then, of course, just participation, I told you that's going to be 30 points. So that's where you get your total of 250 for homework. All right. So that's basically the syllabus. Go through it, and if you see anything. Now let's discuss the drug cards, because that's going to be important when they're due. You're going to have to turn those in. Drug cards must be on a note card. I don't care if the note card is tiny. I don't care if the note card is big. And here's actually an example of a note card, a big one, okay? And someone wrote on the back side. I've had people staple little note cards together. I don't care how you do it, but they have to be handwritten, and they have to be on a note card. They cannot be on a piece of paper. You cannot copy it out of a book and paste it on, because remember, that's plagiarism when you're copying stuff. So put it in your own words. Make it easy. You can color code it, underline it, highlight the major words to it, whatever you want to do. They're your cards, and these are what you're going to use for your learning. These are the things you're going to take with clinicals. These are the things that you're going to do your care plan with. So that's why it's important to make sure your cards are the way you want them, but I need specific things on them. So we're going to go over what I want on them. Quote, so for these drug cards, I expect certain things. Now, the first thing I expect is a generic name and a brand name. Okay, so there's going to be a generic name, and I want you to put generic and then generic name and put what that generic name is. And then I want you, the second thing would be brand name, and I want you to put what that brand name is. All right, so those are the first two things that need to be on the card. The next thing that needs to be on the card is the therapeutic class. Okay, what is the classification of the medication? So that's under therapeutic class. So I want you to write therapeutic class and then tell me what it is. The next thing is the form. The form is actually what the medication comes in. Is it a PO? Is it an oral pill? Does it come in liquid? Is it an IM? Is it a sub-Q? Is it drops? So I need to know what type of form it is. So that will be the next thing. The next thing is indications. Why are they taking it? What is the indication why we're taking this medication? Okay, so that's the next thing I need. After that, you have to tell me the action. So I want you to put action and then tell me what the action of the medication is. And like I said, put them in your own word. Don't write novels. Okay, I've had people write novels and novels of stuff. No, this is for you. Put it in your own words. Make it easier for you to read. So after the action, I want onset, peak, and duration. Okay, so when you do the onset, peak, duration, that's going to be for each form of medication. So if you have to give an oral, I expect you to put the PO, which means that's oral, and we'll talk about that. I want you to put the onset, when that medication will start taking an effect, when it peaks, and how long it stays in the system is the duration. So onset, peak, duration. You're going to do that. You're going to do that for each form of medication. So if you have oral, if you're doing sub-Q, if you're doing IV, if you're doing IM, if you're doing drops, eye drops, you need to put each form down and you need to put the onset, peak, duration. Now I will tell you, sometimes there is an unknown duration. There's sometimes an unknown onset. If it is not known, put unknown. That's all. You don't have to go more than that. After that, we're going to put the side effects. Okay, every medication has a side effect, and we'll talk about that. After that, you're going to put adverse reactions. Okay, and sometimes not all meds have adverse reactions, but my recommendation is if the book says no, look in your textbook. When in doubt, if you don't know what it like a generic or brand name, look in your textbook because it will tell you what those medications have side effects, and it will give you the generic name, it will give you the brand name, it will give you side effects, adverse effects, which is going to help you and also help with your class. So adverse reactions. The next thing is black box warnings. Black box warnings are very severe. Some of them have a lot. So just paraphrase. Don't write every word for word. Like if it says don't take with, if it says a long thing about pregnancy, just put don't take with if pregnant. Don't write the novels that some of the books do. Not all drugs have black box warnings. If they don't, I want you to put none, N-O-N-E. After that, contraindications. Some meds have a lot of contraindications, like you can't take them with certain sleeping pills, you can't take it with alcohol, you can't do this, you can't take it with psych drugs. So if there's contraindications, you need to mark that down. What medications it's contraindicated. You should not take them together. It is absolutely no. So contraindications. The next thing is I want to know is the interactions. What does it interact with? If you take something, what is it going to interact with? And then of course, labs. I need to know what labs will be affected. When you're giving a medication, what labs should you check beforehand? Like potassium. If you give potassium, you should probably check a potassium level because it affects the potassium. So those are some things that you're going to be looking at, the lab level. And last but not least, patient teaching. Patient teaching is the most important. And don't ever tell me there's no patient teaching. There's always patient teaching about medication. Like I said, some people put none, and I will send that card right back. These are the things I expect on the card. Now, there's no issue if you put more stuff on. Like some people put like food interactions, some people put like things they shouldn't be drinking. I'm okay with that. You can put those on there because that's just more helpful stuff for you. But this is what I expect on these drug cards. And like I said, if it doesn't apply, put none. Now, I'm going to tell you right now, if your drug cards are not complete, if your drug cards are wrong, you will not get credit for it. I will give it back to you with a sticky note, and then you must fix that and turn it back in for credit. Because I want to make sure that you get these correct, because these are what you're going to use for your care plans and that, and they need to be complete. And like I said, if you have any issue, call me, because everybody has problems with drug cards at the beginning, and that's okay. And I want to give you an example of a drug card. So if you guys have issues at the beginning, we will discuss it when we actually see each other. Or if I can, I will take a picture and send you an example of a drug card so you know exactly. And I might just do that. I might take a picture of my example of something and send it to you so you guys have something. All right, so that's what I'm going to do. I'll send it to you guys personally. So that might be something that will be, I'll work on to get. So basically, that is what we're going to be doing for pharmacology. I hope it's going to be a fun course. It's very, it's very tiresome for a lot of students, a lot of education. You have to keep up. Don't let those drug cards get behind. Study, 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 study. That's all I can tell you. When we're dealing with the book, let me get into the book. The book is actually very helpful. There's a lot of side columns. I don't know if I can get into, with my thing. But there's a lot of these side columns here that give you a lot of clues and explanations, okay? And those are actually a lot of times are going to be test questions. There's also common side effects that you'll see on there. They have little pictures of the drugs. Those are the big time ones that we're going to be focusing on. And when I go through the lecture, I'll tell you the common side effects, and you'll see those little box pictures. Those are the ones you need to memorize. Those are the ones you need to know. And then, of course, as we go through, there's some odds and ends that I will throw out there. This book likes things with age. This book likes anything with age, like 80, 70, older population, safety issues. Those are keywords you need to start looking for, because that's going to help you with the examination. I don't want you to get behind. If you're having problems, you have to come to me. Do not get behind. If your grades start dropping at the beginning, it's very hard to catch up. So that's why you need to get a hold of me. Either we need to do some tutoring or something to help you with. So please reach out to me anytime. Like I said, the best thing is to message me on my cell phone. But if you have any questions about any of this, don't hesitate. Please, please, please call me, because I want you guys to all pass. And like I said, pharmacology is fun. This is a big part of nursing that you're going to be doing. This is, very serious stuff, and we have to take things seriously. But you have to learn what's important and what's necessary to do for your patients, because you don't want to make a mistake and you don't want to cause harm to an individual. So that is it for the introduction part. If you have any questions, you know what to do. Then what we'll do is we'll start going over chapters 1 and 2. So let me stop this baby, and I will see you guys soon again.